Afternoon, everyone. Right to go? Okay, thanks everyone for joining us here this afternoon. And I'm joined by the Minister for Health, the COVID-19 Commander and the Chief Health Officer. So there's a bit to get through today, as you'd appreciate. So I'll take you through the details of what we're announcing today. Then we'll hear from the Chief Health Officer, and then we'll hear from the Minister for Health in terms of testing and exposure sites, and then we will open up for questions. Okay, so I'll go through some of the data first, and then go to what changes we're announcing today. So there are 6 new locally acquired cases, bringing the total number of cases linked to this outbreak to 60. Our teams are working harder than ever to test, trace and isolate every case and contact in this outbreak. And so are all Victorians, and I want to thank them. And again, some great results both in terms of testing and vaccination. So all Victorians are doing their bit, staying home to keep us all safe, and another record day of testing, more than 50,000, and another 20,000 plus day of vaccination. So that is an outstanding result, and I want to thank everyone for all of their efforts. So we have right now 60 cases and over 350 exposure sites, and a variant of the virus that is quicker and more contagious than we have ever seen before. The best way to stop this virus is via vaccination. But as we know, only 2% of our population is fully vaccinated. If we let this thing run its course, it will explode. We've got to run this to ground, because if we don't, people will die. And if that happens, it's our most vulnerable. It's our parents, it's our grandparents, it's Victorians with underlying conditions or compromised immunity. It's those Victorians who will pay the price. In the end, this is about saving lives. It's why, on the advice of the Chief Health Officer, Professor Sutton, the current restrictions remain in place for Melbourne for a further 7 days, with some small changes. So I'll take you through those now. From 11:59 p.m. Tomorrow night, there will still be only 5 reasons to leave home: shopping for food and supplies, authorised work and study, care and caregiving, exercise and getting vaccinated. People will be able to travel a little bit further for exercise and shopping with an expanded 10-kilometre radius. Students in years 11 and 12 will return to face-to-face learning, and that includes students in other year levels that are undertaking a Unit 3-4 VCE subject. So that happens on Friday. A number of outdoor jobs will be added to the authorised list, things like landscaping, painting, installing solar panels or letterboxing. Other restrictions, including mask wearing, remain in place. At the end of another 7 days, we do expect to be in a position to carefully ease restrictions in Melbourne, but there will continue to be differences between the settings in Melbourne compared to regional Victoria. So I want to be upfront with people that even if all goes well, we won't be able to have people from Melbourne travelling to regional Victoria during the Queen's birthday long weekend. The risk of exporting this virus is just too high. We do want to ease restrictions in regional Victoria, and in a moment I'll take you through our plan to do that. However, with wastewater detections in Bendigo and Axedale and new exposure sites in Anglesea and Northern Victoria, we are in the process of urgently testing or retesting a number of people who may have been exposed. That work is happening today, and the public health team will work their hardest over the next 24 hours to make sure we have all the information we need to proceed with the easings of restrictions in regional Victoria from 11:59 p.m. tomorrow night. So I'll take you through those now. Restrictions in regional Victoria are proposed to ease as follows. The 5 reasons to leave home will be removed, and there'll be no limit on the distance you can travel from home. You can only travel to Melbourne for a permitted reason, and you must follow Melbourne restrictions once you are there. Outdoor gathering limits can occur with up to 10 people. Gatherings are no longer limited to 2 people, and infants under 12 months are not included in that cap. Food and hospitality will be open for seated service only, with a cap of 50 people per venue, subject to density requirements of 1 per 4 square metres. Retail can open, and personal services such as beauty and tattooing can resume for services where masks can remain on. Religious gatherings and ceremonies are permitted for 50 people plus 1 faith leader, indoors or outdoors. Gathering limits for weddings will be 10 people, and for funerals, 50 mourners. Junior outdoor community sport will return, and adults will be able to resume training outdoors. Outdoor pools, including swimming classes, can operate with a limit of 50 people, with a density quotient of 1 per 4 square metres. Libraries and toy libraries can open with a cap of 50 people, subject to density requirements. Outdoor seated entertainment, so that's seated and unseated, will have a patron cap of 50 people, or 50% of the venue's seating capacity, whichever is lower. We've also seen previous examples of people who left Melbourne, broke the rules and took the virus with them. We do not want to see that happen again, particularly with this variant of concern that is this outbreak. So to that end, businesses that are open in regional Victoria but closed in Melbourne, so restaurants and beauty, for example, must check the IDs of everyone they serve. We know it's an extra ask on staff and on customers, but ultimately this is about keeping your community safe. We'll also expand our Service Victoria QR requirements to make it mandatory to check into retail settings such as supermarkets and shops, and that will apply across the whole of our state. Today, I'm also able to confirm that businesses most impacted by the extension of these public health restrictions, including operators in hospitality, retail, events and creative industries, will receive further support. The government is adding a further $209 million. This is on top of the $250 million package that the Treasurer and I announced on Sunday. And that will include $181 million to increase the Business Cost Assistance Program, increase those grants from 2,500 to 5,000 in total. So if you are restricted to 1 week, then it's a 2,500 grant. If you're restricted to the 2 weeks of this lockdown period, then you're eligible for 5,000. So there'll be a single application. $28 million to increase the Licensed Hospitality Venue Fund, and those grants increase from 3,500 to 7,000. Again, if you've been impacted for 2 weeks, then you're eligible for the 7,000. To make sure that businesses need only apply once and that they get their full payment in one go, the applications will now open tomorrow rather than today as planned. We want to make this as simple for businesses as possible. We don't want businesses to be forced to apply twice. We'll also be able to announce a package of support for regional tourism operators and accommodation providers in coming days, and that's a reflection of the impact of that, the continuation of different settings in Melbourne and regional Victoria for a little while, and that does include the Queen's Birthday long weekend. As we did last week, we have also renewed our request to the Commonwealth to activate a JobKeeper-style support for Victorians who have been impacted by these restrictions. The Treasurer has been calling Josh Frydenberg this morning to put that request, and I will be speaking to the Prime Minister later today, and I do hope that the Commonwealth will swiftly confirm that they will step up and provide that support. If they do not, I'll be raising this directly at National Cabinet on Friday. A lot of Victorians, a lot of Victorian businesses are doing it tough right now, and it's our clear expectation that the federal government will provide them the support that they deserve. So I know that this is not the news that everyone wants to hear for Melbourne today, but given the cases that we've had and that we are still seeing, the Chief Health Officer had no choice but to put this advice to government, and the government had no choice but to accept that advice from the Chief Health Officer. If we don't do this, this thing will get away. This variant of concern will become uncontrollable and people will die. No one wants to repeat last winter. To stop that from happening, we need all Victorians to follow the rules, to get tested and to get vaccinated when it's your turn. We can do this, but we need to do it together. To go through the reasoning for the public health advice, which is a critical element of today's announcement and our communication to the people of Victoria, I'll ask Professor Sutton to make some comments. Then we'll hear from Martin Foley in terms of exposure sites and testing, and then we'll open it up for questions. Brett.
Thanks, Acting Premier. So just a quick update on the new 6 cases today. Of the new cases, one is linked to Stratton Finance, has been in quarantine for their entire potentially infectious period, so no new exposure sites from that individual. One individual is linked to Brighton Beach Hotel. They've been staying at their home in Anglesea, and therefore there are a number of exposure sites in Anglesea which have been posted online. As you know, we've got a network of local public health units in Victoria who really drive our work at the moment with contact tracing for COVID, and I've got a great deal of faith in the Barwon Public Health unit, who know the area very well, who've responded through 2020 to colic outbreaks and really as many numbers as some other jurisdictions in Australia have dealt with. So there's a great deal of expertise and local understanding. I've got enormous confidence in them managing this situation. One case is an individual from Victoria who holidayed in Jervis Bay with his family, and the Department of Health advised Victorians last night on that. And of course, New South Wales Health have advised on the relevant exposures in their jurisdiction. His family have also tested positive. That's a spouse and 2 children, making up the remaining 3 new cases. Those 2 children attended North Melbourne Primary School, so that school is closed and contact tracing is underway. And we're still investigating who the index case or first case might be in this family, and indeed how they've acquired it. That's not absolutely clear at this stage because there's no crossover with known exposure sites from the initial interview. As we've discussed this week, this variant of concern is starting to show up in places where normally it would be less likely. So the Brighton Beach Hotel, that was an outdoor dining setting, well ventilated. You wouldn't expect transmission to occur. We still had it as an exposure site. We still informed people to test and isolate until returning a negative. But in fact, all of those people will need to be in quarantine because transmission has occurred there. That's not something that we routinely see, and we didn't routinely see it in 2020, but we have to bear in mind that all the variants of concern now are really a step up to some degree. This Kappa variant, as it's now called, is not the most infectious, but it is more infectious than anything we saw in the beginning and middle of 2020, so we have to bear that in mind. At least 1 in 10 current cases have caught this virus in those casual contact settings, so not the workplace and home close contact settings where we know and expect transmission to occur. I have described it as an absolute beast because we have to run it down to the ground. There are a dozen countries that had no community transmission going into 2021 that have now lost control, that have community transmission and will probably not bring it back to a point where they've got no community transmission again. We have to take a path where we drive this virus back down completely so that we can get control into the longer term. The fact that we're seeing transmission in some of these casual Tier 2 exposure sites or even Tier 3 exposure sites means that we have to re-examine those sites. We have to reach out to people in some of those exposure sites and ask them to quarantine rather than just test and isolate because of the more contagious strain. Again, I'm not giving it magical qualities. I don't need to overplay the danger here. With 150 million cases globally, with 3.5 million deaths, with probably 1 to 3 million deaths just in India in recent months, with the gross underestimation in many countries of the number of true deaths that have occurred, it's absolutely clear that we need to run this completely to ground to be happy that we can open up appropriately. We can't let it get away. We can't go to settings where it would move unchecked with huge numbers of people exposed. So we've got restrictions on for another week to limit the number of unique close contacts that people will have and contain this virus as we did last year so successfully. Thank you.
Thanks, Professor Sutton. So, in Victoria, we are first and foremost governed by the public health advice, and that's out of the driving concern here is for the health and well-being of the people of Victoria. And there are things that you can all do, that we can all do, and one of them is to get tested. And I want to thank the more than 50,000 Victorians who came out yesterday to get tested. Yesterday we did advise people who had been to a number of particular settings where we'd seen some of the more transient transmission that Professor Sutton referred to come out and get tested, particularly if they'd shown any symptoms, but more broadly as well. That same advice obviously applies to all Victorians, but it needs to be added to remind people if you've been to places where these exposure sites are, particularly some of these more challenging ones, we need you to be alert to that reality. So can I again call out some particular locations that we highlighted yesterday and, for the sake of completeness, reinforce today? Those are Clarendon Street in South Melbourne and Bay Street in Port Melbourne, Craigieburn Central, which is a Tier 2 exposure site in some particular hours, Station Street in Laylaw, Broadway in Reservoir, Epping Plaza and Epping North Shopping Centre. As we know, we routinely and thoroughly test wastewater for coronavirus right across the state, and that has obviously been stepped up considerably during the course of this outbreak. We have had a number of unexpected detections, and by that I mean traces of the virus in locations that don't necessarily easily line up with where we know infectious cases are present. And while these unexpected detections may be due to a range of factors, someone who's had COVID-19 in the past who may no longer be infectious, it's also possible that they can be an indicator as to an undiagnosed infectious case. And I can advise that we have had new unexpected detections in Bendigo, particularly between the 27th and the 28th of May. And we've had one unexpected detection down on the Mornington Peninsula, in that section of the peninsula between Safety Beach, down to St Andrews Beach and across to Portsea. That was recorded between the 27th and the 31st of May. There are listed exposure sites in both of these regions, and we're working through those possibilities with our public health team, but the advice to members of the community in those particular areas is if you have any symptoms and if you particularly live in these areas, please get tested now. It's the best thing you can do for yourself, for your family, and to make a contribution to get these restrictions that are keeping us all safe done and dusted as soon as we can. Today also, we've kicked off the disability residential centres and private residential aged care visits to the workforce visits to our 10 vaccination centres that we've opened up for this sector for priority access for COVID-19 vaccinations. And you can find the priority lanes if you are a private residential disability worker or a private residential aged care worker at the following locations: the Royal Exhibition Buildings, the Melbourne Convention and Exhibition Centre, Sandown Racecourse, Melbourne Showgrounds, the former Ford factory in Geelong, Bendigo Community Clinic, Ballarat Mercura Hotel and Convention Centre, the Shepparton Showgrounds, particularly the Macintosh Centre, Traralgon Racecourse and the Wodonga Vaccination Hub. It's day one of the 5-day vaccination blitz for these workers, which the most important thing that you can do is, if you haven't been vaccinated, is to...
Ladies and gentlemen, it's my pleasure today to welcome the leader of the Australian Labor Party, the Honourable Anthony Albanese MP. Anthony, I understand that this is your first Minerals Week Opposition Leaders Lunch. It is great to have you here with us. It gives us an opportunity to thank you for the bipartisan support extended to Australian mining during the pandemic. Health and safety is
It's semantics to a great degree, Rich. We've talked about aggressive suppression in Australia or effective elimination. It's the same thing. It's driving community transmission back down to zero. Well, it's absolutely with a view to getting completely on top of it and having no community transmission grumbling along. We can't have 1 or 2 cases out there and then open back up to the kind of settings we had before. That's what led one case from South Australia to lead to 60 cases and thousands of primary close contacts within a month.
So there's no chance that this lockdown could get extended further if we do still see 1 or 2 cases this time next week?
No, we will review, as we always do, on a day-by-day basis. I have great confidence that we'll be able to go to ease settings after the end of next week.
What indications do you need to see in order to make that happen?
Well, obviously I expect that people will be in quarantine as they're identified as new cases now. In large part, that's a real rationale for a lockdown, that everyone is at home to the fullest extent that they can be, and therefore if they are incubating this virus and become symptomatic and get tested, they've not exposed anyone else. Pre-lockdown, each and every one of us has on average about 100 close contacts, unique close contacts. When we're all moving around that much, if we're transmitting to other people and they all have 100 close contacts, that is hugely exponential transmission of this virus. So the lockdown is to make sure that we see cases who are already quarantining, like one of the new cases from overnight. I'd love to see cases driven down to zero by virtue of that, but if the number of exposure sites stabilise and we're really not seeing new or concerning exposure sites, that gives us all great confidence that we can ease up.
Numbers have not exploded. Contact traces yesterday said they're meeting every key benchmark. Vaccinations are up. We're hitting record testing levels. Melbournians are doing their bit, and numbers have not gone up exponentially. So what's the concern here?
So we have managed that exponential growth unmitigated. So I've talked about the R0 for this virus. It might be 5. That means if you're not altering your behaviour, if you're not doing contact tracing, every person passes it on to 5 others. Clearly that's not happening here. We're chasing down every single case. We're chasing down their primary close contacts. But we've seen a growth of probably a dozen primary close contacts for that first case to thousands upon thousands. Those are individuals who could become positive, and we're seeing individuals where we don't know how they've acquired it. That means there are people out there, potentially, probably, who have it and who are not aware that they're infectious. So we need the number of contacts that each and every person across Victoria has, Melbourne in particular, to be limited to just a few people and not 100 people.
Can you just explain that 10% of people have got it in an unusual situation? How do you compare that to last year? You had hundreds of risky cases last year. How can you actually say this is worse than that?
So certainly through the BlackRock outbreak, the Holiday Inn outbreak, where we were able to track all of those primary close contacts, we didn't see that number who were transmitting in those casual or very short-lived exchanges. They were overwhelmingly in the work and home and prolonged contact situations. through wave 1 and wave 2, no, we didn't have that level of detail, so it's hard to say. But we know that these viruses, these variants of concern that we're dealing with now, are more transmissible. We know the secondary attack rate, the number of people within households, the number of people within workplaces who end up getting infected is much higher than for the original wild-type virus. So it's more infectious, and it shouldn't surprise us if it's happening in casual settings.
Can you just explain that Brighton hotel case, how you think that happened?
So we think that there was an infectious case who was dining there outdoors. This new case from overnight was also dining with a group of other people. They've all tested negative, but this individual has tested positive. They were outdoors, or they were in a well-ventilated, shaded but effectively ventilated setting, but nonetheless transmissions occurred. Now that will happen. We know that ventilation is a great risk mitigator, but it's not going to do the whole thing when you've got a really contagious variant.
Just on the fleeting transmissions, Catherine Bennett said today, in the Kilmore outbreak, Blackrock outbreak, we know that there is airborne spread among people who are in the same indoor setting at the same time. Is there any evidence that for any of these 4 or 5 cases in the last week, that people who were in the same indoor venue at a different time are being infected, or are people there at the same time? And if that's the case, how is that any different from previous transmission?
Well, certainly, as I've just said, we're seeing a greater proportion of our total number of cases arising from transmissions in those casual or more fleeting exchanges. We do have a suspicion that there's been transmission 2 hours after an infectious case has left an indoor enclosed space. They were there for a substantial period of time, but they had left 2 hours before the next exposed individual came in, who's become a case. Now that's in the kind of measles category of infectiousness. It probably relates to an unventilated setting where someone spent a great deal of time, but to come in 2 hours later and be infected, look, it might be on surfaces, but it could absolutely be through airborne transmission as well because of that indoor setting.
Given the level of uncertainty about the potential novelty of this type of transmission, do you think it was fair and reasonable yesterday to use the kind of language that you and Jerome used that was quite a heightened level of language, and use it again today in terms of people might die of fleeting transmission? Do you think the tone was right yesterday, or do you agree with some epidemiologists today who said that they were a bit baffled by the language?
I can't comment. I haven't heard those comments. I'm just speaking to the reality. I've said it's not the most infectious variant of concern out there. It is not at the same level as the wild-type virus that we saw in the early part and middle part of last year. So it's a more concerning, more contagious variant. It doesn't do magical things, but it is fair to say that we're seeing transmission through those fleeting exchanges, and maybe where the infectious case has left the space and another person has moved into it. That's concerning enough.
Just one more on the extension. How crucial in your thinking is the intention to get all those people who are at the Clarendon Street, the Bay Street, the Epping Shopping Centre, these places where fleeting transmissions occur? How keen are you to make sure that every single one of those persons, people gets tested before you remove the lockdown? Is that one of the fundamental underpinnings?
We know we don't get 100% of people necessarily. There'll be people who haven't checked in, who just can't be identified. But when we get back hundreds and hundreds of negatives out of those settings, and it's 80, 90, 95% of everyone who's attended or we think's attended, that's very reassuring. So no, I don't expect 100%, but I'd like to see very high returns on those primary close contacts testing negative.
Chief Health Officer, you're saying right now that you're seeing evidence of transmission that you didn't see during Victoria's second wave. Couldn't that be down to improvements with contact tracing, which is providing better mapping of how the virus is moving around the state this time around?
Yeah, I've just answered that to Raf, essentially. So we couldn't see that granularity of detail through wave 2 in Victoria last year, but through the Blackrock outbreak, the Holiday Inn outbreak, we haven't seen that proportion of cases who are describing a transmission that's fleeting. I don't want to overemphasise it. We still know that most transmission happens in the household. We still know that it happens in these prolonged and indoor settings. We still need to have a lockdown to minimise the number of people who will be in those settings. That's a key feature of extending this by a week. So it's not that all transmissions are occurring in casual settings, it's just to illustrate that the contagiousness of this virus is not insubstantial.
So this
Sorry, one at a time.
So more of a follow-up on
I'll
that.
Matt,
So if you're
take a
saying
ticket and sit down.
Sorry, that type of transmission could have been happening during the second wave. You just don't know about it.
Yeah, it could have been transmitting during the second wave. It probably was. I don't think it was happening to that extent. And in the granular examination of transmission with these new variants of concern compared to other variants and compared to the wild type last year, they're seeing greater contagiousness. They're seeing it take over as a variant. That's why it became, B117. The Alpha variant became the predominant one across all of Europe and North America. It's why the Delta variant is now overwhelmingly the variant in India and becoming the predominant variant in the UK. The variant we're seeing now may or may not go in that direction, but it's of concern.
So is it not just the case that authorities are on top of it, contact tracing is working well, it's more that we just don't want to go out on the weekend and lose all the ground we've made?
We are pulling up neck and neck with this virus, no question, and the contact tracing work that's been done has made a huge difference in controlling that exponential growth. But as I say, there are 5,000 plus close contacts, all of whom are at risk of becoming cases, and there are others out there who we're still identifying who don't know where they got it from. So there are unrecognised chains of transmission that contact tracing can't manage because they're not known to anyone. So it is through lockdown and the number of unique contacts that they have that will manage that. That's why Avalon shut down in Sydney. Pre-lockdown, they would have had 100 close contacts. Afterwards, they had 4 or 5. That makes a huge difference.
With most of the cases then still being in primary close contacts, but not all, what's your feeling on the impact that contact tracing has had versus the lockdown has had now? Because obviously if contact tracing is working and all of these people are already isolated, then lockdown has less impact, but kind of can't be seen over just a week. So what's your feeling on how we've got to where we are with the 2 triggers?
Yeah, I think contact tracing has done all the heavy lifting to this point in time, almost all the heavy lifting to this point in time. For the cases that are emerging now, that are becoming positive now, it's clear that being in lockdown over the last number of days and for the following days will make a huge difference. We'll see people who simply haven't had a number of close contacts, and so it'll be so much easier to be able to run down those chains of transmission because it'll be the immediate household contacts only that we'll need to check and maybe for some essential workers. So that makes a huge difference in terms of running this down and getting ahead of it.
So was 7 days ever going to be enough to test the impact of the lockdown?
No crystal ball gazing is possible in advance of this. What's played out has played out. We didn't know that we would see it introduced into an aged care facility. We don't know that someone who's incredibly infectious just sees their immediate family or goes to a nightclub or goes to a dining setting with many other people. And so a week, fingers crossed, could have been absolutely enough, but we've seen an explosion in exposure sites and we need to bear that in mind in extending it.
The last second wave was a trigger of 5 mystery cases on average over 2 weeks and less than 5 nominal cases per day. By next Thursday, do you want to see no mystery cases and be very confident, at least in your thinking, that there are no mystery cases out there?
No fixed thresholds. All of those factors are factors that we consider. Clearly, we're doing rings of control here that make a difference more comprehensively than has ever been done before. So, I wouldn't be concerned if we've got lots of primary close contacts, but they're all quarantining, they all turn positive and they don't generate new exposure sites. That's a key feature here.
Contact tracers been able to identify how the
No, not at this stage. So there seems to be, some general movement in the same areas, but no definitive crossover with exposure sites. So another one of those examples potentially where casual contact, where you can't identify the immediate close contacts, means that we don't know exactly where it's come from.
Do you need a witness deal this time? Do you need a witness deal?
Oh, we need some restriction of movement between metropolitan Melbourne and regional Victoria. That will be managed through patrols and compliance. It won't be managed with the kind of roadblocks that we've seen previously. We know that people who are highly motivated to break the rules will have a go anyway. They'll be tracked down through roving patrols and the work of VicPol. They will also be managed by a highly motivated regional Victoria that does not want people outside of the region who are not entitled to be there to be coming and accessing services or events.
But do you need the police to stop it?
No, that genomics will be worked through today. I presume it'll come through either very late today or tomorrow.
Yeah, and so that is, I guess we have now pretty examining cases, or you don't
Yeah, so this family are all connected, but one of them will be the index case in that family, and we don't yet know how they're linked to the rest of the outbreak. If we get the genomics back, and as I expect, because New South Wales doesn't have community cases, it's linked to hotel quarantine in South Australia, then that'll tell us that it's been picked up in Victoria. But we need the detailed epidemiological link to give us the assurance of how it's related.
Just to clarify, so we have 2 index cases where we don't know how it's applied.
That's right, that's right.
But has there been in cases for the back to as well as that Woolworths
So none attached to Woolworths Epping North for that exposure day and site. Nothing out of the footy, and we've done pretty extensive contact tracing for those. Again, there might be some people who we've SMS'd who are yet to come through and test, but the immediately seated individuals we followed up very closely. We've got lots of negatives back. Our interstate counterparts have chased up those who've come from interstate and also tested negative, so pretty good assurance that no transmission at the footy.
Do you understand why it's confusing to people of colour?
This virus is passed on by a minority of people to a huge number when someone's infectious. So most people don't transmit to anyone else. A minority of people transmit to 5 or 10 or 15 or 20. That's the danger. So there'll be some settings where you'd expect transmission to occur and that individual just isn't infectious. And some other places where you just don't expect transmission to occur, but you've got a very infectious individual. I don't know. Obviously, we've always just worked on a day-by-day basis. I think it's very encouraging that in the last 48 hours, we're increasingly seeing people who are at home already, who have not been out and about, who've not got new exposure sites when they get diagnosed, and their entire infectious period has been spent at home and in isolation. That's terrific news. Oh, there's no clear number. It's increasingly the case, and it depends on the mix of vaccines that you're using in a country, and we'll get better understanding of the vaccine efficacy as time goes by. But something like 75% of the adult population getting covered with a vaccine is a pretty good indicator that you really drive transmission down. That's what's coming out with a number of different vaccines. So the priority vaccine list is a Commonwealth decision, or it's a national decision, who have always been a 1A priority group, and we are just giving support to the feds in order to make sure that they're getting vaccinated at the rate that is appropriate for them, because they have been left behind here. They've got a very little vaccination coverage where they remain a vulnerable and at-risk population. So we're supporting getting them vaccinated as a priority group. But in terms of teachers, and look, there are lots of essential workers, there are lots of potentially exposed individuals that we'd love to all get through our vaccine program. We're at very high numbers in Victoria, you know, better than anywhere. 20,000 a day is terrific, but it is a national decision on priority groups. You know, teachers who are already eligible by virtue of age, I'd encourage them to come forward and walk in where they can, otherwise book.
There is a mistake. Sorry. The other question was, did the gap make it?
Look, it's really an equity issue with their regional counterparts. We don't want any kids to be left behind here, and you know, I think it's a manageable risk. Nothing is zero risk. I think it's a manageable risk. Those students will be wearing masks. I'd like to remind them that they need to wear them all the time, except when eating or drinking. They should try and make their way to school on their own, not get lifts with other parents. And to make sure they wear their masks on public transport or otherwise as they're getting to school. So I think that's manageable, but it is important. It's a really critical year, and I'm sure the Minister for Education can speak to how critical it is for them.
Just briefly, there's some people in the state Liberal Party suggesting that the virus didn't actually come from hotel quarantine in South Australia. It might have come from someone who didn't do hotel quarantine in Victoria. Is there any doubt in your mind that it's come from South Australia, hotel quarantine?
No doubt whatsoever. And no one in South Australia or in public health is disputing that. Look, I don't do the genomic reports. It's done at the Doherty Institute. Whether that's publicly available, I'm not sure.
Can regional
Regional?
areas?
No, so there are some higher risk settings that remain closed in regional Victoria for the week ahead.
I'm going to Richard's vaccination questions quickly. Have you all the chiefs of the P3 said 24 is the question of if we have say 40 or 50% vaccine and all the vulnerable cohorts vaccinated, has there been any discussion about whether we allow at some point later this year the virus to spread and to move away from this aggressive suppressive strategy if we're confident that everyone who is vulnerable has at least had a chance to get vaccinated? Or will this be the action taken until we reach that 75%, which could be next year?
So there are ongoing conversations. They're not landed. We'll continue to look at the modelling and those deliberations will be presented to National Cabinet. It's not just for public health to be making decisions in that area. I would say it's one thing to cover every vulnerable person with an offer of a vaccine, but that doesn't necessarily stop hundreds of thousands of people getting infected. Long COVID is still a significant issue for people. People are disabled by long COVID. People can carry neurological, neuropsychiatric, respiratory and other organ damage for months and months. And so that shouldn't just be set aside as a non-issue. And it shouldn't be set aside that there are people who are not, you know, classic vulnerable groups who do not have pre-existing illness, who still die from coronavirus. So we have to bear in mind the kind of scenarios that play out with modelling with 40-50% coverage versus 70-80%. We haven't finished in all of those rather complex discussions. There's lots of modelling. It'll be continue to be informed by a deeper understanding of the vaccines and their coverage as time goes by.
Vaccination rollout running behind schedule, how much did that factor into your decision with the lockdown?
I have to bear in mind that the vast majority of Victorians remain entirely vulnerable from an immunity point of view. Only 1 in 1,000 Victorians have had COVID, or 1 in 1,000 Australians have had COVID, so that's no natural immunity coverage at all. There's a couple of % of Victorians who are fully immune by virtue of having 2 vaccines, so that doesn't protect us sufficiently.
What's the sort of plan? snap back, we get back in? Will there one is going to put it on that weekend? Will we be able to put in that game?
Early days, Rich. I wish I could crystal ball gaze. We don't know what tomorrow will bring, let alone a week, 10 days from now. We're all hoping for the best. I think the trend is good. As I say, the last 48 hours are seeing more and more people who are not infectious in the community. That's a really good sign.
Why is the government's QR code system only being made mandatory in supermarkets and retail outlets now, and how are we going to enforce that?
So it'll be enforced through the supermarkets knowing that it's a really important measure. We've always recommended it as an important measure, and in places where it's mandated, it's not always complied with. So all of those elements of information, education, supporting people, and having an app that's really easy to use, like the Service Vic app, that'll be terrific. But the supermarkets are highly motivated to do the right thing, and I know the CEOs of the big chain supermarkets are ready to go with overseeing to make sure that check-ins are happening exactly as we'd like it to happen.
It's already been recommended before. Why will it be any different this time? How are we going to make sure that businesses are complying with this?
Look, I think we're in a position now where the Victorian community is motivated to do the right thing. They understand the importance of contact tracing in this space, and even though we've been doing really well in identifying people at all exposure sites, I think everyone recognises that we have to do absolutely everything in our power to be able to chase down every single person who might be exposed, because it's that one person who's not found who might be the one who spreads it.
Just before you ask the question, I just want to go to a previous question about the GAT and schools. So now that we've made the decision and the announcement that we're going through today, I'll be working with the VCAA and providing advice to schools in terms of the GAT. And when I ran through the changes in regional Victoria, I should have been absolutely clear in terms of schools. So there are lots of parents and students, teachers and staff watching. For regional Victoria, all students and teachers and staff return to school on Friday in regional Victoria. For metropolitan Melbourne, it's years 11 and 12 and students undertaking a Unit 3, 4 in VCE. Just wanted to be clear about that.
Just Friday pupil for a day. It's Friday pupil for a day for the country, city schools. Teachers prepared for next week.
No, so we had the pupil-free day Friday of last week. So remote learning will continue for the majority of students in metropolitan Melbourne for the rest of this week and for the term of the second period of the lockdown. So no additional pupil-free days.
You spoke about the federal treasurer. It's not clear to me, is that like Sunday we want them to step up, we don't think they are going to? Or do you think they're actually going to provide some sort of one-week job keeper payment? What are you expecting?
Well, we're putting our position really clearly to the federal government as we outlined on Sunday. We're stepping up to the plate in terms of support for businesses. $250 million we announced on Sunday, a further $209 million, and we'll have more to say about regional tourism and accommodation over the next couple of days. In terms of what we are asking the federal government to do is a JobKeeper style support program for Victorian workers for the period of this lockdown. That is what we've been advocating for. The Treasurer's, Tim Pallas, has been trying to call the Federal Treasurer this morning. I'll be speaking with the Prime Minister. We need to see this support. We have stepped up to the plate supporting businesses. The federal government needs to do exactly the same thing.
Do you get the sense they're actually going to do that? Because they were saying blanket no on Sunday. Has that changed?
Well, that's a question for the federal government, Raf. That is what we are absolutely putting to the Morrison government. Victorian businesses absolutely are devastated by this lockdown, as are families and communities. They need support, and the support we're providing is bigger and broader than the support we provided in the February lockdown, but we need the federal government to deliver on what they are responsible for, and that is around wage subsidies.
And any progress on quarantine outside of hotels, has that changed? Nicola, has that changed at all?
There's been no change to the last update I gave. So Micklam's our preferred, Avalon is the alternate. We've got access to the site, so we're doing all the work that we said we would do. We're waiting on the federal government to give us a green light. Sorry, I'll go here. On Mickleham, yeah. So Rich, you've got to do the planning and the design work, and that is happening right now. So nothing is holding up the construction of this facility. We've got access to both sites. We're doing the planning and the design work with the $15 million that we put on the table. But, you know, I'm just reminding people, quarantine is a federal responsibility. Howard Springs is a federal facility. What we are saying is that we need an alternative to hotel quarantine. You know, this outbreak that we are talking about and have been talking about for some time now originated from a hotel quarantine breach in South Australia. I think we're up to about 21 breaches in hotel quarantine right across our nation. And that is why we need an alternative quarantine facility. It is absolutely appropriate that it is a Commonwealth responsibility in terms of the funding of the construction and ultimate ownership. We're prepared, as long as it's related to COVID response, we are prepared to operate and run the facility. But it is on Commonwealth land. It should be constructed as soon as possible and ultimately owned by the Commonwealth.
What happens though if the federal government decides they're not going to chip in and support businesses and workers here in Victoria, particularly casual workers? You know, they've gone a week already without pay. They need to pay for food, they need to pay rent. Will the Victorian government step in?
Well, that would be an incredibly poor reflection on the federal government and their support for Victorian businesses and Victorian workers. Victorian workers are crying out for support. We are doing all that we can. The funding that we've provided on the table, applications will open tomorrow, giving direct support to businesses, either to pay rent, to assist in paying wages, to purchase food that is and other goods that are perishable. We are putting all the support that we can in terms of broader support in the welfare sense, working with Food Bank, working with other welfare agencies to make sure we give support to people that are doing it incredibly tough during this period of lockdown. But ultimately, you know, you can only do what we're responsible for, and putting forward a significant support package. The ball is in the federal government's court. Victorian businesses, Victorian workers are demanding that they respond. That is what the Treasurer is advocating for. It's what I'm advocating for with the Prime Minister, and I'm very hopeful of a positive outcome. It's a good question. Our immediate proposal, what we are putting forward to the federal government, is a JobKeeper style support for workers during this period of lockdown. The question of whether we need a more standing support package available in the event of other lockdowns in other parts of the country or indeed in Victoria, that would be a decision of National Cabinet. But the immediate ask, the clear ask, the demand of Victorian workers and Victorian businesses is that the federal government step up to its responsibility in terms of wage subsidies, alongside the support that the state government is providing directly through the business support package.
Just back on the lockdown and restrictions, Professor Sutton said it's day by day again. We can't predict what's going to happen next week. We've already heard that we're not going to be allowed to move out of Melbourne for the Queen's birthday weekend. So what do the restrictions on the Queen's birthday weekend look like? What advice is that based on? And therefore, what is the roadmap?
Well, the advice is based on the advice that we get through from Professor Sutton and the public health team, and it is a day-by-day assessment. We expect to be in a position in 7 days' time to ease restrictions in Melbourne. We expect to be in a position in 7 days' time to further ease restrictions in regional Victoria. But it is fair to say, and I want to be absolutely upfront with the people of Victoria today, there will continue to be different settings between metropolitan Melbourne and regional Victoria for a period of time, and that will unfortunately include the long weekend over the Queen's birthday.
What are the restrictions? What are the restrictions on the long weekend? You said
So what can you tell us? Yeah, so we'll have more to say once we get towards the end of this period, this additional 7-day period of the lockdown for Melbourne, both in terms of what the easing of restrictions for Melburnians look like and what will be the settings. But I want to be clear today that it will include a difference in settings between Metro Melbourne and regional Victoria, that you won't be able to travel. So whether how that is expressed in terms of distance from home, we'll have more to say about that towards the end of this next period of lockdown. No, not at all. This was the preferred position of VicPol, of Police Command. It was accepted by public health and accepted by the government that the best way to enforce these measures that we're talking about is via those mobile patrols, both in terms of our arterial roads as well as the back roads, spot checks in regional Victoria, use of technology in terms of number plates to check that someone in regional Victoria is appropriately in regional Victoria. In terms of the previous setting in the Ring of Steel, resource intensive, you don't get the coverage that you would with mobile patrols travelling around between outer metropolitan Melbourne and regional Victoria, spot checks in regional Victoria. We accept the advice of VicPol that is the best approach. Look, I think Victorians overwhelmingly do the right thing. That's what we have seen throughout last year. It's the reason why we defeated the second wave. So Victorians, whether they live and work in Melbourne or in regional Victoria, Victorians will do the right thing. We've also outlined, as part of these new settings, that businesses in regional Victoria will be required to check the ID of patrons coming into a cafe, restaurant, other settings, to make sure that they are able to be in regional Victoria, either because that's the period in which they're staying in regional Victoria at a holiday house or in accommodation. So the combination of businesses checking ID and very prominent patrols 24 hours a day, 7 days a week, and spot checks by Victoria Police, as well as Victorians doing the right thing, we think this is the best approach. Well, I'll let Professor Sutton and perhaps the Minister for Health talk to this. What we are seeing in this current outbreak is a variant of concern, including, not exclusively, but for some people, transmission that is fleeting, that is stranger to stranger. Every outbreak is different, and the response, the advice from public health is different. So these are decisions that we are making based on expert public health advice.
I'd like to ask a question to Rowan, please. Rowan, in that South Melbourne, Port Melbourne area, you've asked a lot of people to come forward and get tested.
Yeah.
There's a handful of aged care facilities in that region.
Mm-hmm.
How are we going to provide care to those ones if the staff have to leave isolation to go and get tested, as thousands of others who walk those districts?
Well, I think what we're saying to, particularly now, to all those workers in aged care facilities is, if anybody in aged care is remotely symptomatic, we want them to ensure they're going to get tested, and they should not work and need to isolate. And that is part of the staffing challenges of any aged care facility, in fact, any facility. Similarly, what we're also saying, of course, today is that any aged care, anybody who's working in residential aged care, anybody who's working in residential disability, we're asking them again, we're reiterating, you can come forward and get vaccinated. That's the most important thing you can do for the medium to long term. Those vaccination centres, 10 of them are opening up today. We're seeing a really good response today from colleagues in the aged care and residential disability sector. We'd ask them to come forward. Absolutely recognise that for our aged care facilities, for our management teams, for those local homes, there's always a challenge as to how do you juggle with your staff, but this has to happen now. Yes. Yeah, sure. So a couple of days ago, yesterday, I believe, we talked about 2 aged care facilities where we had, of course, 2 members of staff at one aged care facility in Maidstone who have tested positive. All the other staff and residents in that facility have been tested, and only 1 resident has tested positive. One of those staff has also had shifts at the Blue Cross in Sunshine. All residents and staff of that facility in that period have also tested negative. We have a secondary close contact connection to an aged care facility in Heathmont and a further one in Caulfield. Those are very tenuous contacts. We're out of an abundance of caution. We've asked both those facilities to go into lockdown, all the staff and residents to be tested in those facilities. I expect to have those results in the next day or two. But we're very pleased and very grateful for the support we're getting from all 4 facilities at this point in time.
Do you have an update on how many people are self-isolated?
Sure, absolutely. So as we stand here today, we have around 5,200 primary close contacts across all aspects of the outbreak, and of course that includes, we're doing ongoing investigative work, particularly with the new cases that came through last night, the Jervis Bay family, or the family who were in Jervis Bay, I should say, and the one new case that came through from the Brighton Beach Hotel. We have 78% of those 5,200 primary close contacts have already returned a negative test result. So again, we're continuing to see really good negative results come through as we roll through these exposure sites, over 350 exposure sites. As of this morning, we identified a number of exposure sites in Anglesey, as the Chief Health Officer has referred to. Earlier this morning, all those facilities have closed, all their staff have been sent home, and they'll be getting tested in the next day or so. And my thanks again to Barwon Health. They've deployed an additional testing facility down there to support that work programme.
Do you have an update on the condition of these virus cases? Anyone in ICU cells, do you know how the infection?
Yeah, I mean, obviously more of a question for Brett, but in terms of the 60 active cases we have in the community at this point in time, we believe one person's currently in hospital. They're not in ICU, and of course all those individuals are getting continued support from ourselves. We of course wish them well with their recovery.
So we had about 700 or 800 close contacts overnight.
That's right. So we've had around 700, 600 close contacts overnight from the numbers we had around this time yesterday.
And just confirming, sources are still unknown for 2 cases, or with the additional case today?
That's right. Yeah, so at this point in time, yesterday we had 2 links that we were continuing to explore. The link between our original Victorian in Wollert who came out of South Australian hotel quarantine. We're still investigating that link into the main City of Whittlesea outbreak. We're still investigating the exact link between the 2 staff members and the resident at the aged care facility into the rest of the outbreak. And now, of course, we have our mystery case, the family of 4 Victorians who have just returned from New South Wales. We're, of course, trying to identify what their connections have been. We expect to get genomics, as Brett has said, hopefully late tonight or tomorrow morning. That will, of course, help us to tie it into the wider outbreak, and then we'll continue the work around contact tracing for that family. Rich? Look, as I think Brett's covered that question very clearly earlier today. No, not at all. Done with it? No.
Brett, can I ask a question about vaccine supplies? How are they going specifically?
That might be one for Jerome as well, but go ahead.
Either or. How are our vaccine supplies going, specifically for Pfizer, and when will we open this online booking portal? People are trying for days to get on the phone, but they cannot get through.
I appreciate the frustration of people who are really keen to get vaccinated. It's fantastic to see people so keen to get vaccinated. There are limits, and supply is one of them. With hundreds of thousands of people, millions of people have actually called the hotline over the last week. So that's a terrific sign that most of Victoria is ready to get vaccinated tomorrow if they could. There are about 71,000 Pfizer vaccines a week being supplied. That is not expected to increase in the immediate future. So that's a constraint. We will get through that supply on current use, but we can't step up more than that with that current supply. AstraZeneca supply is less than that, but we know that the second dose for AstraZeneca will be coming online, if you like, for a lot of people in coming weeks. So we'll need to step up the numbers of vaccines with AstraZeneca we give in coming days. We've got constraints at the moment, but the call centre could have 10,000 people on, and there'd still be more calls given the demand at the moment. So please be patient, I would say, and if you can't get it today, check back in a week's time. Everyone will get a chance over a period of time, and we'll be in a better place for it. In terms of the online portal, we are working through testing. We want to make sure that it works perfectly well when it comes on, but it's not going to create spots that aren't there already at the moment. We've got pretty full bookings through the call centre. We've got full bookings as people walk in and queue up very patiently as well. So for a lot of people, it'll just be a case of being patient, waiting for that supply to increase in coming weeks and getting a vaccine when the chance comes.
Is the constraint with supply or the logistics of just getting people through the doors? The second half, we're supposed to be getting 1 million doses of AstraZeneca a week. If we've got fewer than 5 hours.
So, look, you'd have to go to the Commonwealth in terms of what the production capacity is for AstraZeneca at the moment. It might be close to 1 million now. A huge number of those are going to GPs, so people should shop around for their vaccine. Look for the GPs who are providing it. You may well get a booking in advance of the mass vaccination centres from the state. So look around and look for something nearby. But the AstraZeneca doses, some are held in reserve, half for that second dose. Same with Pfizer, and a lot are going to GPs. So it's not all about the allocation to state mass vac centres. I'm not sure. I haven't seen that come to HPPC. It might have been published online, but I haven't seen it. Look, I think a lot of people are waiting appropriately, even if it's a couple of hours. We're not seeing huge blowouts in waiting times. Yeah, look, there are clearly some that get to capacity very quickly. Mornings tend to be worse. People should bear that in mind. If they can come at a time when it's a bit quieter, that's a useful thing. You'll get through faster. But it is important to have a look at the waiting times online. Because you might only have to travel another 10 minutes and you'll save an hour in terms of waiting. So there are, a couple of hundred sites stood up, and it is worthwhile looking at the website and shopping around for a place where you can get through easily. Yeah, of course we did. We have to consider the significant challenges, especially to younger kids, as schools close. We're not at a point where we can confidently open schools across the board in metropolitan Melbourne at the moment. The Murdoch Children's Research was really important. They had lots of lessons for what the mitigations in school with ventilation, with mask wearing, with spacing can do. But again, with variants of concern, the landscape has shifted since that report. Singapore has closed schools because they're dealing with the Delta Indian variant that has affected children more significantly, more severe illness and more transmissible with children. So that was in mind as well. But none of this is easy to choose. We are so aware of the harms across the board, personal, business, economic. It is that awful choice between doing what we know we need to do now for a week versus waiting, letting this get ahead of us and having to choose it for 6 or 8 weeks down the track, which would be so much worse. We know that these are tough times to go through. And for kids missing out on their mates and missing out on that face-to-face learning, which would always be our preference. But we don't want to be in a situation where we've got significant outbreaks in schools, more transmission in the community, and needing to make a choice about a longer period of lockdown because it gets away from us.
You have mentioned the Delta variant there.
The legislation will work through those nuances, but it'll be not dissimilar to some of the exceptions that we saw last year.
Professor, in the answer about schools, you just mentioned the Delta variant. Just to clarify, there's no evidence of that here. We're always talking about the Kappa variant.
That's right. So, look, the Delta and Kappa variants are related. They share many of the same mutations. That's something for us to bear in mind. but it's also to say that we're not dealing with the same virus as we were last year, and so we need to be alive to the fact that transmission in children might be different, severity in children might be different, but mostly we need to drive this right down to be happy that we can open up. That's right. So Kappa is the B1617.1, the sublineage of the Indian variant, and Singapore is dealing with the more infectious and potentially more dangerous one.
Chief Health Officer, what advice have you given the government as the Chief Health Officer regarding the mental health ramifications of extending lockdown?
So as I've just said, we are so acutely aware of that dilemma. The choice about extending a lockdown now is about avoiding even worse consequences down the track, because transmission is too substantial. It gets ahead of us in terms of the case numbers or the number of close contacts. So those harms are so acutely known to us, but you only have, again, you have to look around the world to see what's happened when it's escaped, where transmission just continues with huge numbers affected, and lockdowns that never really ease off, where businesses close for months and months on end, and people are isolated from their loved ones, from their friends for weeks and weeks on end because transmission continues. It's an awful dilemma, but as I say, the dozen countries that had no community transmission for a year and were living life freely are now in lockdown and seeing thousands and thousands of cases. And for some like Thailand, they will not get back to being free of community transmission. And so they've got, those tough choices about how their communities are affected for months and months from now. We don't want to have to face that dilemma in Victoria.
With all due respect, we're not in Thailand.
We're not in Thailand.
Best case scenario for Victoria, we get on top of the community transition this week. What happens next? Are we looking at another 2 weeks of restrictions for Melbourne, 3 weeks forward? How slow is this easing out going to be? Best case scenario. I know it's hard to reach, but if we get 0 cases for the next week, what does it look like?
I haven't put my mind to it. I don't expect that we'll get 0 cases for the next week. We will look at the data every day. If there is no transmission whatsoever, if there are no new exposures, if there are no new cases, that will put us in a really good position to ease substantially, but with the recognition that there will still be thousands of people who need to finish their incubation period, who could still become cases, that there still might be unknown chains of transmission who haven't stepped up and gotten tested. Now, I know we're not some of those countries with very substantial transmission, but Taiwan, not a lower middle income country, a pretty developed country, probably got complacent about where they were at. They are facing 10 to 15 deaths per day, 300 new cases per day from nothing. So we have to bear in mind that we're not a special case in Victoria. This is a virus that could take off anywhere in the world.
So there's settings for schools other than, Metro Melbourne, so other than VCE students, year 11 and 12, and those students doing 3-4. For all other students, the settings remain the same. So for whether it's a specialist school, a primary school or a secondary school, vulnerable children or children of authorised workers can continue to go to school and be supervised at school. But beyond that, we're not making any other changes for the next week. In terms of travel for work from metro to region, we won't be able to do that. Yeah, understand the question. I might get the Minister for Health to respond directly to that question.
If I understood the question, so if you live in metropolitan Melbourne, but you're an approved worker in regional Victoria, you can take your, you can go to work, but you take your restrictions with you, and you aren't. So therefore you should not eat in an open restaurant in Geelong, and that's why we want in that kind of example, the proprietor to help police that arrangement.
When you talk about the rate of Melbourne, is it the same rate of Melbourne as last year?
Yes. Yes.
We have one case in hospitals, not even in ICU.
Yes.
What's the advice at the moment for elective surgery? Surely that can...
Well, no, the advice on elective surgery hasn't changed. The existing arrangements for emergency surgery, which continues unabated and continues at essentially 100%, and the Category 2A emergencies continue. All other elective surgery, very regrettably, has to cease, and that's partly to reduce movement, as Professor Sutton's indicated, but it's also partly to address the reduction of movement in what are high-risk, high-care settings, our public and private hospitals.
Can I ask what the advice was in terms of extending the 5K radius to 10 kilometres?
So extending the 5K radius to 10K is really a reflection of some of the feedback through last year that people look to have exercise sometimes in areas beyond that 5K that is safer for them, or that is in an area where it's more appropriate for them to exercise. There are some significantly built up areas in the suburbs, and that 10K for retail purposes where permitted, for food and for exercise is just a little bit easier. It doesn't make a world of difference, I totally recognise that, but for some people it is the difference between exercising in a place that they feel is safer than would otherwise be the case.
Will that make a world of difference to the average individual or to the virus spread?
Well, probably both. I think that we are comfortable enough that the 10K limit can be in place without significantly increasing the risk.
Professor Sutton, given we now have coronavirus cases in North Melbourne, is there a plan to stop the virus from getting into the housing towers like we saw last year?
Yeah, so there's been work with the towers right through to have awareness of everything in regards to testing, isolation and quarantine, but also we want to prioritise them from a vaccination point of view. Again, I'd encourage them, as for other at-risk populations, to come forward for vaccine, and we want to prioritise them as a group that are at higher risk.
How is that communication? Just in terms of, I guess, getting multicultural leaders to talk to people living in those towers, how's that been so far?
I'd have to get back to you. I know that there's been close engagement, but I'm not aware of the specific details.
Do you know if there's any cases that reside in those areas?
No, there are no cases in tower complexes at the moment.
Just got a really quick question for Antonia. Just in terms of the onus being on regional businesses to check ID, what advice and what support will they give if someone does present with an ID from Melbourne? What do they do?
Look, if it's clear that the person who's coming into the cafe or restaurant shouldn't be in regional Victoria, then the expectation that we have on those businesses is that those people are not served and quite clearly told, it's not appropriate. We want to support businesses doing this. We know this is it's an imposition on staff and on businesses, but we think for very, very good reasons. If it's not followed, then there are fines that may be placed. But I think this sends a very simple message to businesses, simple message to all Victorians. If you shouldn't be in regional Victoria, don't go there. And you may be pulled over by the police asking why you're in regional Victoria. You may be asked at a business when you're asking to be served, should you be in regional Victoria? I think this is going to be a critical thing and frankly supported by people in regional Victoria. Regional Victorians don't want the virus to spread into regional Victorians, and we think this is an easy thing for people to do. It's pretty common sense for people who are in regional Victoria. Either they're in accommodation and they're there for the period of the lockdown, or they're in their holiday home, for example. So you're right. I'm answering your question, Rich. So it's either your ID, which shows you should be in Melbourne, not regional Victoria, or if you are from Melbourne and in regional Victoria for a legitimate reason, you've got the utility bill at your holiday house, you've got the receipt from the accommodation in terms of where you're staying. It's very easy for people to show businesses, I'm in regional Victoria appropriately and not in contravention of the rules that are in place.
Some people tell me that some people are aggressive, some people come and try and film something for a YouTube channel. We've seen it before in other lockdowns. Can businesses call the police? What happens if they do get a particularly aggressive person?
Well, certainly if there's aggression, like in any scenario, Victoria Police are there to support the community. So none of that behaviour is tolerated. This is about common sense. You know, you shouldn't be in regional Victoria, other than if you live in regional Victoria or you've got a legitimate reason and you are staying in regional Victoria. We don't want people travelling from Melbourne to regional Victoria for the next period. So we're going to apply a very common sense approach. Individuals, of course, sometimes people do the wrong thing, sometimes people behave badly, but I think Victorians would understand that this is a common sense approach and it's an easy thing for regional businesses to do. Simply asking a patron, have you checked in using the QR code? Are you legitimately in regional Victoria? If the answer is no, then that person cannot be served.
Last time you were going back over all of the exposure sites. Yep. One, how is that being done? And two, are you looking at that twice again? I understand somebody's reported that they were on board and they've been asked to take a blood test. Yep. So what's going on?
Yeah, so we continue to review all the cases we've got. We continue to review the exposure sites associated with the cases that we have. Make sure there's no stone left unturned, make sure no other information comes to light. And as Professor Sutton has said, we've seen continued changes in the way that as we see each new case, it gives us a bit more information about how this particular variant of the virus is working. In terms of the original flights, this is the flight that left Adelaide and arrived in Melbourne on the 4th of May with our Victorian on there who came out of hotel quarantine in Adelaide. We are checking other people on that flight for serology to see whether they were by any chance carrying the virus, whether there was any other route that we could possibly follow up.
You do know the 7-Eleven,
yeah, so we had, I think as I said yesterday, around 120 primary close contacts who identified from the original positive case that came in. All of those continue to be reviewed. We continue to review that they completed their isolation properly. So that work, we do as a matter of course, and we'll continue to do that. That's pretty, it's a question for Brett about how that works, but it's a blood test.
So you've asked, just going you've asked 100
No. Let's be very clear. So we are following up people who were on the plane from Adelaide to Melbourne. I don't know how many people there were, who were with the individual who came out of hotel quarantine. We're following them up and asking them to undertake blood tests so we can do some serology, see if there's any other trace that we can find. We are really keen to identify this missing link piece, and as Brett has said earlier, we are concerned about that there may be people continuing to circulate in our community who do we not know about. This time yesterday, we did not know about the family of 4 who are in West Melbourne who have just turned positive overnight. So it is those mystery cases, those unknown cases that are the greatest risk to us all, and that's why we'll do everything we can to find those missing links. Okay, I'll come back to that. That's not something I'm aware of.
Just on the placing contact tracing earlier, that's already given us an example where it appears the virus or the suspect of the virus jumped from Can you just give us some more details, maybe another example of the physical contact transmission?
Yeah, look, I think yesterday we went through a number of different exposure sites where we have seen, I think 4 I mentioned in particular, JMD from memory and a few others, where we have seen transmission between strangers in a venue, people who did not know each other before they went in, people who had no knowledge of each other as they were in the venue together, who came out, and there was that fleeting transmission that took place. That is not something that we have seen in the Holiday Inn outbreak, in the Black Rock outbreaks. It is quite different in the dynamic in which this is moving. No, there are two people associated with the Mickleham display home. One positive case who we knew was associated with in there, and then one other person who was in the venue. That's right, who's tested positive. So both of them tested positive. So we had a case go into the Mickleham display home. The person who was working in the Mickleham display home was subsequently tested positive. We declared that case about 3 or 4 days ago.
There was no false positive.
No.
That woman has got us this morning, the contact of the worker that she returned a negative test today.
All right, so we would need to come back to you on that one. So we're very clear. We have all the positive cases. There are 2 positive cases associated with the display home in Mickleham. One was a member of staff from Stratton Finance who went in there. One other was a person who was working at a display home. She, of course, in turn, will have a series of other primary close contacts. It may well be that, and we've certainly tested a number of those. They have all tested negative. That may be what you're referring to. Any more questions for me?
We don't know when we're getting out of this. That is frustrating to every Melbourneian who's doing the right thing. What is your message to them, just to sum up today's press conference? Because we don't have an end date.
My summing up for all Victorians, for Melburnians, is that Victorians know that we can get through this. And Victorians also know that the only option available to all of us, whether it's governments, whether it's individuals, is that we all follow the advice of our public health experts. That is our path out of this. It does mean for a period longer, there will be the lockdown and the 5 reasons to leave home. But at the end of this next period of 7 days, we will be in a position, we expect to be in a position, where we can announce further easings for Melbourne. We can get through this, but the alternative cannot be considered. We live in a world where only 2% of our population is fully vaccinated, where only 2 out of 10 people have received their first jab. We can't let this get out of control. We've got to drive this down, because that is what will save Victorians, keep us safe and ensure that lives are not lost. Thanks, everyone.
Hey, Joshie.